everyone, I'm Jada, founder of Boober. Boober is a platform where expectant parents and new families can find all of their pregnancy to postpartum care providers like birth doulas, lactation consultants, postpartum doulas, and mental health therapists for pregnancy to postpartum. So we're here today to talk about preparing for pregnancy, birth, and postpartum during COVID-19, some things to know and be aware of. In most places where you will give birth, almost everywhere is requiring the use of your mask, to put on a mask and have that face covering throughout labor. Usually they're going to issue you one. They may issue something at the hospital that you can use, but the main thing to think about right now is actually getting used to having your mask on so that you're not in a situation for the first time huffing and puffing throughout your labor, having never worn the mask. So I'm encouraging everybody to take multiple times throughout your day while you're in your home doing your thing where you normally would not have to wear a mask. Put the mask on, do some prenatal yoga, some stretching, some walking, some exercise, some movement. Keep it on and see what it's like to wear your mask during that time so that you can the more we get used to wearing it, the more desensitized you become to it, the less it will feel, things like people talk about how uncomfortable it is. Of course, there's the heat on the face, the humidity. People wonder, am I really going to be breathing enough during labor? And yes, you will still oxygenate all that you need to. We just need to get used to that. So that's one thing to know about. A couple other things to think about are if you are COVID positive or you test positive, and almost everybody is getting tested at most hospitals now when they come into labor or the night before if they're having an induction or a planned birth. So thinking about when I walk in the door, if I'm going to be tested, okay, well, what if I do test positive even if I'm asymptomatic? Can I have my baby in skin-to-skin contact after I give birth? So that's another question you really want to discuss with your midwife or doctor. Is skin-to-skin contact advised, and can I nurse after the baby is born? We know that skin-to-skin contact is what's recommended by the American Academy of Pediatrics immediately after birth if all is well with the baby, and it is now being recommended on an individual basis to discuss, whether or not skin-to-skin contact is supported. Most people lean toward supporting skin-to-skin contact, and breastfeeding is considered to be fine with COVID depending on the state of the lactating parent. The main issue while nursing, if you are COVID positive, is that while holding a baby right here, the droplets that can pass from birthing parent to the baby because of that intimate contact of nursing. So it is important to always wear a mask, vigorous hand washing before nursing the baby if you are positive, and washing the chest actually is also recommended. So in some places with skin-to-skin contact, they'll do that first, wash the chest, and then allow nursing, or they may place a sterile field and have, sterile sheet and have the baby come onto there, but it's an individual discussion. So those are a couple things to think about during COVID-19. People ask, can I go out with my baby? In general, whether I'm COVID positive or not, and into the community. If you can maintain social distance and you can then go out with your baby and have a walk, you always want to talk to your pediatrician. But most people do recommend for birthing parents, for lactating parents, for new parents, for moms and dads, and to really going outside, and getting a little fresh air, if safe, is really helpful for mental health. So we, recommend talking to your care providers, and those are a few tips to think about during COVID.